This is Oliver. He's an 11-year-old pug. Oliver was brought into the emergency room at about 9 o'clock at night for chocolate toxicity. While his owners were out to dinner, Oliver had gotten up on the table and eaten 2 of the complimentary chocolate bars that had been left by hotel staff. While Oliver's owners hadn't noticed any symptoms, they knew it could be serious, so they called and got assistance right away. The problem with chocolate is that it contains natural stimulant compounds or uppers, like caffeine and theobromine. An overdose of these stimulants can lead to rapid heart rates, arrhythmias, seizures, and even death in the later stages. Dark chocolate and baking chocolate contain much higher concentrations of these compounds, and so these are a lot more dangerous. Milk chocolate and baked goods containing chocolate generally are more diluted with other ingredients and so aren't usually as dangerous. I always like to start by running the numbers through an online chocolate toxicity calculator. In some situations, if you have a big dog that ingested milk chocolate, it's possible that emergency intervention may not be needed. On the other hand, with Oliver, when we entered his numbers into the calculator, it was evident that we were in the red zone and that he was at risk for developing severe symptoms of toxicity. When Oliver arrived, you couldn't really tell by his demeanor that he was experiencing chocolate toxicity, but when I listened to his heart, it was beating at about 240 to 280 beats per minute, which is really, really fast, to the point of being dangerous and life-threatening. Normally, a dog his size would have a heart rate of about 100 to 120 while at rest. When the heart beats too fast, the heart chambers actually don't have time to fill, and so the body has difficulty delivering oxygen to the tissues. Oliver's heart rate was dangerously high, and emergency blood tests indicated that his tissues were not receiving enough oxygen. We placed an IV catheter and started him on IV fluids, but ultimately he required heart medications to help bring the heart rate down. We monitored his heart's electrical activity and blood pressure continuously until things eventually normalized. He was also supported with supplemental oxygen. Luckily, Oliver didn't experience any seizures or tremors, but we do see that at this level of toxicity in many cases. If chocolate ingestion is caught right away, then a lot of times we can prevent these patients from developing symptoms like rapid heart rate and seizures by inducing vomiting. But once the symptoms are already present and the compounds have seeped into their bloodstream, this isn't as effective. Oliver did receive activated charcoal to help prevent further absorption of the caffeine-like compounds from the intestine. Ultimately, this was a life-threatening intoxication, and Oliver had to spend the night in the hospital. Like most other intoxications, chocolate toxicity can be prevented. Make sure to keep this and all other poisons safely out of reach of dogs and cats. Don't ever let your guard down. And remember that there are other people in your pet's life that might introduce these substances, like pet sitters, friends, and hotel staff. So always be on the lookout. Chocolate toxicity is very, very common. When in doubt, contact your veterinarian or the ASPCA Animal Poison Control for additional instructions. And as a final warning, be extra alert for an artificial sweetener ingredient called Xylitol. This is also very toxic and potentially lethal to dogs, and it's starting to show up in a lot of different food substances. As you can see, pugs on caffeine and stimulants can be a little bit hard to work with. They're very active and agitated, but ultimately as things started to improve, Oliver's heart rate came down and he finally got some rest.